So we might just get going. First of all, I'd like to thank and welcome you for participating. Gosh, I can see some of you here from, if you've logged in from your computer, I can actually see the names popping up. And it's a lot easier for me to, obviously, for you to get my attention by raising your hand, so I can unmute you and we can have a chat. If you're dialing in via phone only, but you haven't actually logged in through your computer, I can't see you. I can't actually see you on my list, which means you will have to SMS me if you have any questions, and I'll put my mobile phone number there for you to SMS in a second. Now, we will get started with the evolving role of nurses in travel medicine. This is a topic that is very near and dear and close to my heart. As you may know, we've been running travel medicine workshops which have been a lot of fun, and the nurses that have been participating seem to be enjoying them a fair bit, so that's good. And every time we run a course, we obviously take the feedback from that course and the ideas. That's the main thing, the ideas that nurses bring into the course, and we use that to develop new resources and essentially improve the courses as we go. Now, today's session is really meant to be more of an exploration of the role that we as nurses play in travel medicine, in general practice, and in other settings. Now, a little bit about myself. My name is Magali De Castro. I'm a registered nurse, credentialed nurse immunizer. I'm very passionate about general practice. I've been working in the general practice sector now for 8 years. I also work as a practice support officer at Bayside Medicare Local, a Medicare Local in Victoria. I'm the founder of practicenursing.info, which is a website that I hope you guys are using and finding helpful. I've had a long history of working with the divisions of general practice previously, which is, some of you may know, I'm with the not-for-profit organization supporting general practice, and now they've evolved into Medicare Locals, which is really more around supporting not just general practice but all primary care providers. I do a lot of presenting and speaking at conferences. I hope to see some of you at the APNA conference next weekend, not this weekend, but the next one. It's also going to be the weekend of my birthday, so if you see me at the conference, say happy birthday. No, you don't have to. That's a joke. But anyways, I just thought I'd tell you a little bit about me, so that if you haven't met me before, you know who's talking. All right, let's get going. So why did I choose travel medicine, and specifically the role of nurses in travel medicine as the topic to review in this teleseminar? The main reason is essentially this quote here: travel medicine is one of the fastest growing medical disciplines. Yeah? This is from the Infectious Diseases and Clinical Practice Journal. But this is something that in my travels and in supporting general practice and practicing, when I work as a nurse, I work more as a locum, so I move around from clinic to clinic and help set up different nurse-led clinics in a practice and train the nurses there. I also work as a nurse supervisor in a clinic here in South Yarra in Victoria. So what I've noticed is through my travels and going through supporting different medical centers, there's been a definite increase in the focus on travel medicine. A lot of clinics are now very keen on either incorporating travel medicine as one of the areas or the specialty areas or services that they offer to their patients, or if they're already offering some kind of travel medicine component because they already have some of the vaccines and things like that. A lot of them are looking to increase the number of vaccines that they're providing, or proactively promote the travel medicine in their practice. So we're seeing a lot of clinics now applying to become yellow fever accredited, and then with that comes sort of the idea of, well, let's get some of the other private vaccines. Let's have a quick look. If you've got here, if you have any questions, make sure that you use the questions tab, or there's my mobile number. It's 0432 537 973. That's 0432 537 973. Feel free to SMS me questions if you've got questions that you want me to address, which I'll probably address at the end of this session. All right. Now, I just thought with the exciting thing about travel medicine is not only is it one of the fastest growing areas, especially in general practice, but what I believe is, as nurses, we are in the prime position. We're actually the fastest growing discipline in medical group of professionals, health professionals, nurses in general practice, that is. So we're actually in a great environment because as you'll see throughout this session today, a lot of the bulk actually of travel medicine is not just on what vaccine you're going to get, is on all the risk management and the assessment and the patient education, which is where as nurses we thrive, and that's where we tend to shine the most. So there really is an opportunity for nurses to essentially revolutionize travel medicine and really put it on the radar. Now, first of all, I just want to share with you some of the numbers of, well, how big is this really? And we know one of the reasons travel medicine is growing is because just travel in general is on the rise. It's more affordable than ever now to travel. I just went to Singapore and back for $400 return, which was outrageous and fun. But yeah, you can actually get access to flights ridiculously cheaply, and we're more connected than ever. So because of that, we have more travelers. Now, I'll go through some of the stats so we have a bit of an idea of all these travelers, what's the actual risk. Now, we know we have in Australia, it's well over 6 million overseas departures. So every year, there's at least, well, actually the latest figure that I saw from the 10th edition, the Immunization Handbook, is saying 6.7 million, but that was actually in 2010. So even the 10th edition handbook is still, you can only really do so much to stay on top of the figures. So 6.7 million people traveling overseas or departures, exiting Australia every year. Of this, if we take every 100,000 of these travelers, especially if they're going to the developing world, we know we'll have some of the following. We know about 50% will experience some health problems while they're abroad. We also know that 8% will need to be seen by a physician. 5% will be confined to bed. 300 patients will be admitted to hospital. 20 will require air evacuation. And at least one will die while traveling abroad. Now, these are some of the stats of what happens to our travelers, or this is some of the risk that travelers are facing. If we were to have a look or have a guess, for every 20 people planning to travel, and you can have a bit of a mental projection or try and answer this mentally, how many people do you think would actively be seeking travel medicine advice? So these are the patients that are turning up to the clinic and they're saying, look, I'm going overseas and I'm wanting some, I'm just wanting to make sure that, if I need any shots or anything like that. Or people that are going to a travel clinic or ringing a travel health hotline, which usually leads into a travel clinic consult. We know that actually the number of people that are actively seeking management or preventative advice is 1. 1 in 20 patients, 1 in 20 people who are traveling will actually seek travel health advice. What that means is we actually left with 19 of these 20 people who are traveling and they're being exposed to what we saw in those statistics. And not only are they being exposed, and we'll have a look at some of the implications of that, but there's a lot of times there's not a lot of there's no awareness of the risk. So we have a lot of unprotected travelers, and we know that number is growing. Okay, now let's break it down. Why would this be? Why would we have, out of every 20 people who are traveling, only one person concerned about or actively looking at checking if they need anything to make sure that they're safe while during the trip? Part of the reason is, well, cost of the consult and the cost of the vaccine. And I often hear from patients going, well, you know, this, and it was certainly the case with myself with this trip to Singapore. The cost of the vaccine, because I ended up having typhoid vaccine, was actually more than the, well, obviously not just for myself. There was, again, the people that I was traveling with, was actually more than the cost of the flights or sometimes the cost of the accommodation, especially if you have patients who are traveling and backpacking, where they can actually get really cheap accommodation. It can be a bit of a tough sell to get patients to sort of go, oh yeah, that's fine, I'll have all these shots. The other thing is lack of time. A lot of patients just don't have the time or leave it to the last minute, and we don't have the time to get the regime and the doses in the order with the time that we need them to. The last thing is just simply unaware of the risk. There's a lot of patients and a lot of travelers are just not really aware that they could be at risk, that there could be something, some conditions or especially infectious diseases that they would be that they would be at risk for, just because of the destination that they're going to or because of the type of activities that they're going to be doing while they're overseas. Now, what's the real cost of the traveler illness? Part of it is, well, obviously, if you do come down with something, and I actually did in this trip to Singapore, took all the precautions. The one thing that I hadn't managed to get in there was a flu shot, because I actually ended up going before we had the stock in, and well, you know it, I came down with it. So the one thing. But we know that there's the unpleasant, distressing experience and the unpleasant time that you have, well, if you come down with something. You can lose holiday time. Fortunately, we didn't really have to return early or anything like that. But yeah, certainly a number of people are having to have had to change their flights. We are putting family and friends and other travelers at risk. So obviously, everybody around us, when we come down with this infectious disease, is now at risk or will be potentially exposed. And then the other thing is travelers that are going out and contracting different conditions are putting us back home at risk when they return. So that's where one of the big areas of travel medicine is not just the pre-travel. We tend to focus a lot on the pre-travel elements, but there's also the advice that has to happen around post-travel. What happens when you return? If you're unwell, what should you do? Now, the other thing is, because a lot of the talk around travel medicine and travel health can often be very negative and very much what you've heard about risk and what are the statistics and what can go wrong and, you know, who could die or end up in hospital. And we also know about the cost, the actual financial cost should anything happen, which is why, especially when we do our travel medicine courses, we actually have a big discussion around the importance of recommending patients get travel insurance. This is not just for, you know, it's not just for misplaced luggage and things like that. We know that it can actually be the thing that sends people into financial ruin. So very important that even though it's not really, you might say, oh, look, you know, travel insurance is not really part of my my job description, or it's not really one of the things that's not technically health advice, it actually should be. If you're doing any kind of travel medicine education or dealing with patients on a travel medicine basis, you should always look at suggesting, obviously you're not going to say which one, but always saying that, look, do your research. There's a lot of information on Smart Traveler, the website that's been set up by the government, on how to choose a travel insurance that's going to be good for your patient. So having said that, what I always say is, look, the focus is always on safety and managing risk and making choices on the best available evidence. Yeah. So it's not necessarily on fear. It's not fear tactics, but it is about being safe and promoting our patients be safe and smart. What patients ultimately decide to do or not do is their choice. We can't really force anyone to either have a shot or a vaccine or to not eat foods that are potentially going to be contaminated or or just have take liberties with risky behavior. But what we can do, and what I believe is actually our duty of care as health professionals, is to ensure that whatever choices these patients are making are actually well informed. So regardless of whether they decide to be smart about it or they decide, no, just looking at my situation, I'm quite happy to risk not having any shots, or I'm quite happy to risk not taking any preventative measures. That's fine, as long as they have all the facts. Now, this is where it gets interesting. This is where I usually ask, or when we usually discuss the different levels of involvement at our workshops. So as a nurse working in general practice, depending on the type of practice that you're working in, there's going to be different levels of involvement. By far, the majority of nurses will initially be involved by just administering. So the patient will have gone and seen the GP would have ordered, well, these are the shots that they're going to have, these are the vaccines. Then they come to you and we just essentially administer. Yeah? There are other levels that we could be, where we could be involved. We can actually be proactively promoting that patients have a travel medicine consult. Now, one of the other things that I make sure that we sort of discuss with the nurses is, look, the travel medicine consult is not something that you tack on at the end of an unrelated consult. Really, on average, an adequate, a proper travel medicine assessment and pre-travel consultation should take between 30 and 45 minutes. So this is where we see or specifically I see the potential for us nurses, and this is certainly an area where I've had the pleasure to work in the practices where I've been involved with travel medicine, is the level of patient consult, where you could actually have the patient coming to see you first, just like they do with health assessment or care plans. They come and see the nurse first. We go through, we actually do the full assessment. We have a look at their itinerary and we have a discussion around, okay, well, because of their profile, essentially, their risk profile, this is what we see are potentially the areas of risk. And these are some of the ways where we can manage it. We have vaccinations, we have vaccines available for some of these. We have just preventative measures available for others. But the key here is the more upskilled or trained a nurse is, the more we are able to then handle that consult component. Now, there's no item number for travel medicine. So it's not like we can, see the patient for half an hour and claim an item number and away we go. But what does happen is, obviously, that's saving time from the GP. A lot of the times, especially in the clinics where I've worked, the GPs are quite happy to both bill those sessions, because really they're getting plenty of income through the vaccines that we're selling, if there's going to be vaccines for. And it's not just limited to vaccines. For instance, in the South Yarra practice where I work, we also have travel like diarrhea kits. So we're essentially it's pre-packed so that we can teach them, and we've got patient information leaflets and everything in there of what to do should they find themselves with traveler's diarrhea. Same with first aid kits. So there's other things that are bringing in income. So even if we don't have an item number and we're not able to charge for the nurse consult, there are other things that are essentially helping support that nurse's wage. The other thing that other practices have done, and this hasn't really happened in any of the clinics where I've been involved, but I have spoken to nurses where this is the case, is they actually have a consultation fee. They have a consultation fee that's a non-Medicare rebatable fee, and sometimes it's a small fee between $10, $15 to $20, where the patient is seen by the nurse. They go through the assessment and develop a management plan. That's not as in a care plan, but as in, what are the things, what are the strategies, or what are the vaccines that we're going to give you. And then they go in, see the GP, and that's how it's sort of done, because that's the other thing. And I actually already had a question come in about that. Even if you're a nurse immunizer, we can't initiate travel vaccines. We'll talk a bit more about this later. So there are ways where, look, we could do the bulk of the work. The patient can go in and see the GP, and then the GP might decide to charge an item 3 or a 23 or essentially okay what vaccines we've agreed on, but then we were able to handle the rest. Now, I also wanted to give you a bit of a taste of, this is probably like 10% of what we cover in the workshop, but I find it quite interesting, so I thought you might as well. You might find it interesting too. So let's just have a look about travel medicine as a whole, because what I find is a lot of the times less than 20 to 15% of nurses who are working in general practice and in practices where there's travel medicine services being offered, less than 20% have actually had any formal training on the fundamentals of travel medicine or what travel medicine actually is about. So I thought we'd cover a bit of this now for your benefit. Now, with travel medicine, the key things are that it's a specialized and complex area of practice. Even GPs will, it's not something that all GPs will be readily able to provide services around. There are cases where really should be referred on to travel specialists, and that's another, again, that's part of understanding scope of practice for us, but also for GPs, is knowing where your skill limitations lie. Now, I'm also noticing that there's a couple of you that have your hands raised. I will come to you in a bit, and we will actually have a bit of a live question and answer. I'll get back to you in a second. Now, we also know that travel medicine, unlike many or most other areas of medicine and health, it changes quicker than anything else. Why? Because you might have an outbreak in a region overnight, and all of a sudden now the advice that we're providing patients is going to be completely different to what we would have done a few hours before. That doesn't really tend to happen with something like diabetes management or asthma management. They tend to be fairly stable. Yeah? We have our best practice guidelines, and they're relatively stable. With travel, it's a bit of a different beast, which brings you to another point, which is, we know if something can change so quickly, there's a lot of limitations to printed resources. So if we're relying on printed guidelines and printed, for instance, the immunization handbook, we've only just got the 10th edition handbook, but we had our old version up until a month ago. That was extremely out of date. Yes. So especially in an area like travel medicine, if you are working in this sector, you have to have access to resources, ideally web-based, that are updated on a regular basis. The other thing is, a lot of practices rely on the medical software, because it often has enter your destination here, and it'll spit out the list of vaccines or recommendations for prevention. Now that can also be, you say, well, look, it's my clinical software, that should be up to date. And a lot of times, yes, it's more up to date than a lot of the printed resources. However, you have to remember that you only really get an update for a lot of these clinical softwares every 3 months or so. And even that, every time that you get the update, you don't necessarily get the travel medicine component updated. They might fix some bugs or do an improvement here or there, but it doesn't mean that every time you get an update that the travel medicine area or side of it is going to have new information or updated information. So just be very mindful of that, out-of-date information in medical software. The last thing is, well, if you're going to be a health professional working in this area, you must understand the fundamentals, and that's what I wanted to cover a little bit of next. So there's essentially 5 elements of a pre-travel consult, and this is what we go into in detail when we do the intensive workshop. And I'm not trying to just push and sell the workshops, just this, obviously, in this time that we have allocated for the tele-seminar, we just cannot cover everything, and it's just it's a different environment. So here are the 5 elements of a pre-travel consultation. The first element is risk assessment. As I've been mentioning, we need to find out who's really in front of us. Yeah, there's a lot of different things that will affect the risk profile of a patient. Not just their destination. Actually, their destination, and it's even in the current immunization handbook, but it was in there as well before. identifying or basing your decisions of or your risk assessment on just what destination this patient is going to be visiting is very ill-informed, and it's actually not by far not the best way to go about it. There's a lot of other things that would put patients at risk. Things like not just the destination, but length of travel, their age, whether they're pregnant or not, the purpose of the trip or the visit. So you have to have a bit of an understanding of all the things that would actually increase or decrease the risk of any particular patient when they're about to travel. So we have to do a really thorough risk assessment as the first point. And that's the other area where having things like good checklists in place, but understanding also why every one of those items is in a checklist or in a template. That's where it's really golden. The second step is risk communication, which is once we've done an assessment of, okay, we've taken into consideration all the different things that this patient presents, or the full picture of this patient, we're actually then discussing with the patient, okay, based on all the information that you've given me and the information that I have about you, including things like, what conditions they have, if they have any chronic illnesses or things like that, then this is what I'm finding would be the possible risks for you during this trip. So you have that moment where you're discussing the risk, and then that's when we go into risk management. When we come up with a plan of action of, okay, now that we know what the risks are going to be because of whatever your profile is, then what are the things that we're going to put in place? And a lot of the times it'll be, okay, so these are the vaccines that we have that we can offer you. Again, are optional, but a lot of them are going to be recommended, unless the only exception is required vaccines, which really is only yellow fever. And sometimes, depending if there's it happens often with religious pilgrimages, where there might be also other vaccines required, like meningococcal vaccine. But really, the main one that's often required, not really an optional thing, to allow entry into some countries is yellow fever, which we also go into a fair bit of detail, but we can't really cover that in this session. Now, the next step, or the fourth step, is records and documentation, making sure that we get the paperwork right, making sure that it's not just about, obviously, the documenting the list of vaccines, especially if they're going to be required and they're going to be checked at customs, but also things like medication lists, any advice or patient education, and as well as other resources that are going to be helpful for the patient should they come into any trouble or find any issues while they're overseas. The last thing is the post-travel advice that I hinted at before. This is one of the key things, what to be vigilant for on return from their trip. Someone becoming, the big one is malaria. Someone becoming unwell when returning from overseas needs to be aware of how quickly to seek professional help or health professional, the help of a health professional, but also what to say to make sure that an adequate assessment is done, but also that prompt and adequate treatment is given should there be any issues. All right. This is another quote that I came across that I thought was quite good. Everyone advising persons planning to travel to high-risk regions, especially if it's of the tropical world, should have a working knowledge of these areas. One of the things that we often say is one of the best ways of learning about travel medicine is to travel yourself, but also, obviously, as I've been mentioning, getting your hands on some of the resources and that can allow you to stay up to date with what's going on in terms of outbreaks or the general risk profile of different areas and regions. And certainly, we have guidelines like the Yellow Book and there's CDC website. We have the immunization handbook, but I've certainly found that there's no one guide that will cover everything. You have to really have your toolkit that you can access for a well-rounded well-rounded information and knowledge base. Also, the other key thing is having access to travel medicine specialists, people who have special interest or expertise. It's really invaluable. You learn so much from just being around the people that have dedicated special part of their career to that. Now, some of the common questions that you need to have an answer for, and this is one of the things that I found. It didn't really matter whether or not I was involved in the consult where we did the risk assessment and where we came up with a plan and advice with vaccines. Even if I'm just administering, this is one of the things that you have to have on in your toolkit. You have to have the answer to these sorts of questions, because it doesn't matter how long they've spent with the GP. It's as soon as they walk in and they come in and see the nurse that they start shooting questions at you, and if you have no idea where to even access the information, it can really shake your confidence. So you don't have to have all the answers, and it's possibly impossible to have all the answers, but at least having an idea of what the answers could be, and more importantly, where you can find the answers for the patient. So here are some of the questions. What shots am I going to need? Although often this will be already decided. This would have been decided by the GP or ordered by the GP. The patient might say, I can only really afford to have one out of all these shots. Which one do you think is going to be the most important? Now, you might say, look, this is not really a decision for us to make, but it often comes down to that, because they sort of go, look, they went in and out of the GP consult. They don't really feel comfortable having that discussion, or they just didn't have time. And so you end up being the person that answers these questions. They might also ask you, well, what are going to be the side effects of this vaccine? How long is it going to be until the vaccine kicks in? How long will I be protected from? How long will it take for me to be protected? Can I go out and start having dodgy foods from tomorrow and I'm sure not to get typhoid? The other things that they might ask is, well, how long am I going to be protected for? So once I have this vaccine, is that good for life? And that's an interesting area, because we know that the protection profile shifts, and there's ongoing research happening, and we just saw it now again with the new immunization handbook. There's slight variations in terms of when we give booster doses, when it's going to be needed, when it isn't going to be needed, how soon or how late. So that's a constantly evolving area, which again, you're never going to have all the answers, but you can give them the answers. Again, it's best available evidence. So far, this is what we know. Then the other question, what medical paperwork am I, if any, am I going to need to travel with? What are they going to ask for when I'm at customs? And that's usually more going to be around yellow fever, but you also can have issues with patients traveling with medications, especially because sometimes medications that are over the counter here might be illegal substances in another country. So you want to make sure that you're not getting, or that patients are not getting themselves into trouble unknowingly. Some of the other questions is, I'll have all the shots except the flu vaccine, because I hear it gives you the flu. I don't know how many of you have for this one, especially around now. This is flu season. The other one is, should I have this shot if I'm pregnant? That's it's always a very controversial area. And now the new edition of the immunization handbook is actually it's actually got a lot of information around immunization in pregnancy I've only started going through it. Now I haven't obviously read it cover to cover, but it seems to be they're actually really covering pretty much with every condition in every area where there's a vaccine. They're really going into a fair bit of advice to safety in pregnancy, and it seems to be more comprehensive than it was in the previous edition. Then the other thing is, and I've had this before, can you write all that down, like after we've had this whole conversation, so I can remember it later, please? Which is where, okay, if we're smart about it, this is where things like having ready-made patient fact sheets and brochures and instruction sheets, like I was explaining with the traveler's diarrhea kit, can be a huge time saver. And it also means that, it's a safeguard from forgetting to include anything that's important. All right, what else can we? Now, this is a great little site that I always promote. I don't know how many of you have seen it, healthmap.org. It gives you up to the minute. I'm not sure if it's up to the minute or up to the the last couple of hours information on recent outbreaks. You can actually hover over the different buttons and the different pins, and it tells you what the outbreak is, and it actually gives you a link to related news on that outbreak. So it's also having, and this is some of the things that we cover in the workshop, the series of tools that help you make let the penny drop for patients. A lot of times they won't actually perceive the risk, or the risk won't be all that real, especially if there's going to be a financial outlay of cash to get vaccine. But if you can actually point out, well, look, this is where you're going, these are the issues in that area at the moment, it just makes it a bit more tangible and a bit more real. Now, I won't go into a lot of detail of the key diseases and conditions, but I just wanted to very quickly give you, at a glance, you may not really be able to see this all that well, this slide, because obviously there's a lot of conditions. There's a lot of conditions, and these are conditions that affect travelers. The main point of this, of me putting all of this in here, is to one, give you a bit of a glimpse of how big the world of travel medicine really is, but also at the end of the day, now I've highlighted in red the things that we actually have vaccines or things that we could offer our patients. So even though it's a really overwhelming list of conditions and illnesses that patients could come in contact with, there's actually less of that is what we actually have vaccines for, we actually have treatment or management solutions for. So if you start getting a good grasp of these other key areas, you're sort of well on your way. Now, to take this next step is I've divided this into the different modes of transmission. Yeah, so divided this by color, and so you'll see that you have in the blue we have, which is the largest list, things that are transmitted person to person, or via droplets, or they're airborne, or via contaminated soil. And then we move on to things that are conditions that you can contract from contaminated food and water. Then you also have things on what conditions you can contract from animal contact. Then also what you can get from mosquitoes or tick bites. Then also blood or sex or medical procedures. And then the other things that are just essentially from circumstance, things like motion sickness and deep vein thrombosis. So the key thing about this is what I found interesting in my study of travel medicine is in each area, in each mode of transmission, we have things that we can offer our patients, but we also have things that we don't, just medicine hasn't given us anything for. Like we don't have vaccines for some of these things. So one of the key areas is knowing how to provide advice in preventing contamination through these modes of transmission. So just because you give someone a typhoid vaccine doesn't really mean that you're actually protecting them from every single disease or issue they can come across from contaminated food and water. So you still need to give education, patient education around how to manage or prevent contamination from ingesting food and water. Same with person to person, animal contact, etc., etc. So that's again one of the areas to upskill. It's not just what vaccine for what area. It's all these other type of patient education that we'll be providing. Which again, you don't need a GP to do this. This is something that's well within the realm of a nurse if we upskill in this area. Now, this is a bit that often generates a lot of fun discussion when we have face-to-face workshops, and this is, well, how do we make an impact in our practice? The most exciting thing is when we actually have the discussion and we start getting all the ideas of what different practices have in place. But this is just a bit of a quick overview. So we have traveling patients, and we know from our stats earlier on that that's going to be about 20 to 25% of the population is going to be traveling. So potentially, that means that all the patients that are coming through your practice every year, 20 to 25% of those patients are planning to travel in the next 6 to 12 months. Yeah. So if we have a look at, okay, we have traveling patients, and then we have the next step of, well, are they attending the clinic for any reason? Are they attending because they're needing a script, or are they attending because they're due for a care plan, or are they attending for they need a sick certificate, or whatever it is. If they're attending for any reason, then are we offering travel advice? Yeah? And this is one of the things where having a system in place where you're prompting or you're able to very quickly, easily, and efficiently prompt and offer travel advice where it's needed, where, you know, you're not going to go into a full pre-travel consultation with every patient if it's not going to be appropriate with this patient. So having a system in place where we're prompting to essentially detect or screen out which patients could be planning to travel in the next 6 to 12 months. Are we offering them travel advice? If we are offering travel advice and they decide to take it up, fantastic. Now we have a protected traveler. Yeah? Now what happens if they're attending the clinic for any reason, but we don't offer travel advice, or we're not really prompting for them to ask or self-identify if they are if they're going to be traveling in the next 6 to 12 months? Then, well, hopefully, maybe the reason why they're attending is because they want travel advice. Now, this we know is likely to be the case in 1 out of 20 patients who are actually traveling. So this is not really a good, solid, fail-proof way of ensuring that patients of our practice are protected. So if they are coming for that reason, perfect. We offer the travel advice. We have a protected traveler. Now, what happens if they're not attending the clinic for any reason? Because not every patient is coming in every year. There's some patients that don't really visit their GP. You know, they might have a year or two without visiting the GP because they just never got sick. Do we actually have a system in place at our practice where we can proactively invite them to come in for a travel consult? And this is where the great ideas come in, because we get to hear where the different things that different practices are doing. Because obviously you can't, sometimes sending recall letters to all of your patients is not going to be a viable option. So it's always interesting to hear all the creative options or creative ways where how nurses and practice managers are inviting patients who may not actually be attending the clinic to have a travel medicine consult. Now, if we do proactively invite them and they say, yes, I want travel advice, perfect, we have a protected traveler. The other scenario is, you know, if we're not proactively inviting them and they're not coming to the clinic for any other reason and they don't go to any other clinic, like the 19 people out of the 20, before they travel, then we just have an unprotected traveler, which is a risk or an issue. The other thing is, obviously, if we invite them but they decline or they're not interested, again, we end up with an unprotected traveler. But at least we should give them the benefit of the doubt and prompt and promote. Because a lot of the times it's just not, it's a lack of awareness of the risk. Now, we're pretty much coming to a close, so I just wanted to sort of start summarizing where to from here. We do have the intensive workshops but regardless of whether you do one of the workshops with us or you decide, no, look, you know, I'm happy to learn this by myself, these are the things that I believe are the key things to make sure that you're on top of your travel medicine in your practice. You need to have an understanding and a grasp of the fundamentals of travel medicine. I would highly advise that you go beyond something like the immunization handbook, because even though it does have some information about it, it's still extremely limited. And it doesn't really go into details it doesn't really go into details of the fundamentals of travel medicine. It doesn't really cover that area. It's mainly just, again, it's an immunization handbook, so it's really limited to just vaccines. Then you also have to get a good grasp of the most important vaccines, guidelines, and tools that you need for immunization and for travel medicine. And as we said, the more up-to-date they can be, so the more they can be web-based resources, then the better, because they'll be more current. You need to be able to confidently perform pre-travel assessments, even if you're not actually going to be doing this in the setup where you're the one doing the pre-assessment and they're not seeing, they're not really seeing the GP for long. You're essentially the one going through the risk assessment, the discussion with them, and deciding what vaccines they're going to have. Even if you're not going to be involved at that level, it's a really good idea to just get an understanding of what assessment skills are required, because they actually do again, it's risk assessment. This is going to transpose to other areas of your practice. So understanding what are the areas that we screen pre-travel, and how do we tailor advice to our patients is really valuable. The other thing is, well, this is something that we cover. This one is a bit of a gimmicky thing. It's essentially 3 essential questions that you could ask a patient who's about to travel that will give you essentially a quick way of prompting. So it's finding really your own way of prompting and promoting and eliciting information around travel to have that discussion. Because how many times are we doing a wound dressing or something completely unrelated, or even giving a flu shot, and a patient will disclose, oh yeah, I'm going overseas in a couple of months and I'm really excited about this, and oh, that's fantastic, and then that's the end of that. We don't necessarily promote, oh, maybe you should come back and book a time to have a pre-travel assessment. Oh, why? There you go. And that's where you would need to have good information to give them, and essentially entice them to come back. Because just go on, I think this is a good idea. It may not be a strong selling point. Now, the other thing is having templates, checklists, and tools that will make your life easier. Now, there's a bit of a love-hate relationship with templates. I personally love templates, but I also think that they have a potential to become what they call checklist medicine. So there's a potential for practitioners to be reductionist, or just concentrate on ticking the boxes and forgetting about the reason why that box is there. There's always a larger conversation or a bigger purpose or a rationale for those boxes to be there. So certainly a big supporter of templates. Love creating them. There's a lot of them on the practice nursing website, especially around health assessments and care plans and things like that. But they're really just a starting point. They're a prompt. You really have to have good assessment skills and just in general to have a conversation that's going to be meaningful with your patient around that. The other thing is you have to understand how to modify patient advice if there's any changes, or if there's any disease outbreaks, as we've said, which can happen overnight. So having access to to the minute information can be quite vital. And then these are just the dates. If you are interested in coming and joining us for the actual workshop, we're going to have one in Melbourne on Saturday the 1st of June, and one in Sydney Saturday the 15th of June. And these workshops, the way we're running them is they're an intensive half-day workshop, and we've sort of decided the morning sessions are best. So we start from 9 a.m. and go till 12 o'clock, and that's how we cover a whole lot of information. Plus, obviously, you're handing out all the resources, all the templates and stuff that I personally use that you get to take home. But as you know, I'm extremely approachable, and so if you have any questions, I'm always happy to answer anything. Even now. So we do have a couple of questions. I'll just start addressing these ones. If you have any questions, feel free to SMS them to my mobile, and we can try and address them now. So the number is 0432 537 973. Again, that's 0432 537 973. And I actually have here Diane. Okay. Hello, Diane. Can you hear me?
Yes, I can.
Hello, Diane. Now
Hi,
you have your hand up. Did you have a question? Good.
Yes, a couple of questions. Number one, I did get a copy of your flyer that you've got coming up on the 1st. It did have on there that it was Sydney, but I gather it is Melbourne. And is that flyer correct for the details of where the hotel?
So yeah, it's actually going to be, it is Melbourne. I'm actually going to send out, that was a rookie mistake.
That's okay.
Melbourne, it said Sydney on it, but it is, that's the Melbourne date, and it is a Melbourne event. It's the time is correct, and it's going to be next to Southern Cross Station. So it's going to be in Melbourne in the CBD. Yeah.
Okay.
So I'm actually going to send out an updated fax to the Victoria practices, just so that you have that with the correct, that says Melbourne, but the rest of that, all of it is correct. And the mobile number at the bottom, that's actually my mobile number, so if you have any questions, that's where you can reach me.
Okay, so I'll book into that because it is something I want to do. The other thing is that I just wanted to ask, is there also a area that you can actually buy the travel kits, or should you buy travel kits, or just recommend that patients actually get script for different things, or how do you go with, I suppose you'll discuss all that on that day, will you?
Yeah, well, we definitely go through all of that, but just very quickly, I can tell you there are places where you can buy the all of it. Really, you can buy the first aid kits. Obviously, you can buy the vaccines from your medical suppliers. The only one that's a limitation is the yellow fever, because you do have to be a yellow fever accredited clinic in order to stock yellow fever vaccines.
Yes.
But aside from that, all the other vaccines you're able to purchase and sell to patients. Now, the thing that I would talk to you specifically is looking at the needs of the practice, because a lot of these vaccines, well, both of them are really expensive, so you don't want to stock up and then have stock left over that your practice isn't necessarily moving. And so a good idea is to just start testing what kind of products are your patients more likely to take you up on, or decide, yes, that's a good idea. But yeah, I'm more than happy to talk to you more about that, because it will depend on the clinic. A lot of the travel, there's the travel clinic, there's the specific travel groups, like the travel doctors and travel clinics, and a lot of them actually sell the kits, the ready-made kits themselves. The vaccines you would purchase from medical suppliers. So, but it's the kits, and even the yellow books. They also sell the yellow books where you would write in the list of vaccines given, including obviously yellow fever, and putting the stamp where applicable. Yes. Now that book you can actually get for free from a couple of the medical supplies. So they charge like $10 if you buy it from one of these travel clinic providers. But yeah, I think Sanofi definitely if you get in touch with your local rep, they can provide you with some for free. They only really do it if you're a yellow fever accredited practice, because the main reason behind it is for yellow fever documentation. But yeah, I'm more than happy to have more of a chat about that. Yeah.
And from a bulk billing clinic, we're a bulk billing clinic, because from a nurse point of view can you book out sort of a travel, is there a Medicare travel a number that you can use, or is that why generally it's best to go through the doctor?
Unfortunately there is no travel medicine item number either for GPs or for nurses. So what that means is, if regardless of whether the nurse or the GP does it, it has to go as a standard consultation item. So it would either be, and again, if you're claiming a GP item, it means that the GP has to be involved at some point.
Yes.
So you can't really claim an item 23, which is your standard consult, if the GP never saw the patient. Yeah.
Yes.
So
okay.
Also because with travel medicine, with travel vaccines, even if you're a credentialed nurse immunizer, we're not really allowed to initiate them technically, even though we can have the conversation and say, yeah, look, these are the ones that you should be having, because of your risk profile and destinations and your itinerary. But you still need an order from the GP, essentially the GP authorizing, that those vaccines are good to go. The advantage is, obviously, if we've done that big consultation with the patient, the GP is only going to have to take 5 to 10 minutes to everything, but they're not having to do the full risk assessment, the discussion of the risk, and then come up with this is the plan, and then explain all the different vaccines. That's something that we can take over and we can do. And so if you're a bulk billing practice, that would be by far the best. Yeah, it's the best way, where you would have the consultation with the patient, and then they would go in and see the GP for a bit, and then the GP can claim their 23 or whatever item they want to claim, and then you can provide the vaccines or whatever other product. This is the other thing. If you have a bulk billing clinic, do you have a lower socioeconomic sort of demographic, or do you have culturally diverse?
Yeah, we probably do have culturally diverse, but we have a whole range too. So we certainly see a fair share of travellers that do come through. And initially I used to say to the doctors, you know, it's out of my scope of practice to be telling you what you need to do, and it needs to be directed from you. And, you know, I can certainly go through what they need. But the other thing that I was going to ask is that, is them giving a script, is that enough to warrant me then saying that I've got the instructions, or do they actually need to write in the patient's notes, I authorise for this to be given?
Yeah. Yeah. So if they've actually printed out a script, usually that'll be in the medical record. So it's actually essentially acts as the order. Yeah, that's fine. Because it's going to be identified specifically to that patient, and it's going to say, you know, that specific vaccine. So that's fine. That would act as your order. They wouldn't have to come in and see the GP again. Once they've done that, they can just come in and see you and have the shot. Now, are you a nurse immunizer?
Yes, I am. Yes.
A credential? Yep. Okay. Because then the other thing is, if you weren't a nurse immunizer, then and for whoever's listening that isn't a nurse, a credentialed nurse immunizer, you need to make sure that if you're ever immunizing, you need to have a GP in the building, in case they don't have to be in the room with you, but they do need to be in the building in case there's an anaphylactic event. But as a nurse immunizer, you're fine. Yeah, you're able to administer, and having that script would act as your
my orders.
Your order, yeah.
Okay, that's lovely.
Wonderful.
Thank you.
Thank you.
I'll see you on the 1st. No, I look forward to seeing you on the 1st, and it'll be great. Thank you.
You too. Pleasure. All right. If you have any other questions and you want to have a chat, like we just did with Diane, you can just raise your hand. The way you can raise your hand is by clicking on the little hand icon. Now, I'm just going to read a couple of questions here that came through. And we've answered this already. So how does it work if I'm a nurse immunizer? Does the GP need to see the patient? And the answer is yes, at some point, but you can actually take over the bulk of that care. The reason you'd need the GP involved at some point is to essentially authorize the vaccines that you're going to have. Now, there was another question of how many clinics. This actually came through quite early, and I've been trying to chase up some of the reps that I know who I thought maybe they'll have the answer, because you couldn't really find this stats anywhere. How many clinics now, how many GP clinics are doing travel medicine? You know, I know that we have over 7,000 GP practices in Australia, and most GPs will do some element of travel medicine. So it'll either be from using some of the routine vaccines, which it's actually one of the key things, and we actually cover that in a fair bit of detail. Having your routine immunizations up to date, it goes a long way in protecting travelers. But then you have, as I was talking to Diane before, you have practices that are looking to sell their own travel kits and their own travel vaccines, or practices that just send the patient with a script, and then the patient can get those vaccines from somewhere else and come back to the practice and have them administered. So look, and this is now anecdotal. I don't actually have the percentage and the right figure. But I know that of the GPs that I come across and of the practices that I come across, it would easily be between 70 to 80% that do some kind of travel medicine component. It gets less when you start getting into a really specialized clinic, so someone who would be yellow fever accredited and quite proactive and attentive with their travel medicine health promotion. And that would probably come back down to, and again, this is completely anecdotal. This is not stats based on anything that I've seen. This is just from the practices that I've come in contact with. The ones that would be more involved would probably be around 15 to 20% of practices that would have that sort of level of travel medicine involvement. However, having said that, a bigger thing that I've noticed is more and more I'm seeing GPs approaching me and say the Medicare local or approaching different support organizations because they're wanting to incorporate travel medicine in a more serious way, or they're wanting to become yellow fever accredited. And I think a big move for this is, well, one, we know that it's a growing area because people are traveling more, and we're getting it's the awareness of it's increasing of travel health advice, and that you should visit your GP before you travel. But the other thing is, if you think about it, vaccines are essentially one, if not the only product that a lot of practices can sell, really, aside from services. We don't really have that much product. It's not like a pharmacy. Like a pharmacy can sell all sorts of different items and cosmetics and things like that. But in a GP clinic, you're really limited to services. You need physically a GP or a nurse providing services so you're able to claim things. So a lot of the practices that are looking to expand business-wise are really looking at travel medicine as an area to do that because it's essentially one area where we have products that we can sell. The other misconception is, really travel medicine is for clinics that have high socioeconomic or demographics. We have essentially wealthy patients coming to that practice, and they're just the rich and the famous essentially traveling the world, and that's actually partly that's been historically the case. But one of the highest risk, if not the highest risk group, is people visiting friends and relatives. So a lot of it is actually migrant families. That's why I was asking that question with to Diane of do you have a lot of culturally and linguistically diverse patients in your practice, because they're actually at increased risk for a whole heap of different reasons. Partly is because they tend to go into more sort of localized or rural areas. They stay longer. They're not staying in your 5-star accommodation. They take more risks, and a lot of them assume, well, because I was born somewhere. For example, I was born in Venezuela, and that's where I lived until I was 17. A lot of people in my position would assume if I need to go back, I should be fine because that's where I was born. And that's actually not correct. Now that I've been out of South America for 10 years or more, I would actually need shots to go back because my natural immunity to a lot of things has now faded. Well, hope that answers the question. If wondering if there's no other questions, we might then bring this to a close. We will have a recording of this tele-seminar available to download. I will send you all an email if you attended via internet, which means that I would have seen your name. I will send a CPD certificate for you if you just dialed in using your telephone, or if you're watching, or if you end up watching this later, or if you have a colleague that watches the recording of this later, then you have got to send me an email to request the CPD certificate, because I will not know who you are to send it to. So that's about it for now. You've got you can contact us via the practicenursing.info website. You can use the contact us tab, and you can put in a query, and that sends me an email directly. You've got my mobile number there as well. And yeah, if you wanted to register and join us for any of the workshops, you can actually register online, or you can download the form to register via fax if you want, and they're both in practicenursing.info under education travel courses. I hope you enjoyed today. Thank you very much for participating, and we will see you at the next, you will hear me at the next tele-seminar. Thank you very much. Have a good night.